So my name is Chris Keller. I'm an otolaryngologist practicing in the Fox Cities. So a frequent reason for a patient to come in and see me is that they're snoring at night, stopping breathing at night, sometimes bedwetting, difficulty in school, difficulty paying attention. I would encourage you to come in and have your concerns investigated. The first thing we do is go through a detailed history of what sort of issues have been noted. Sometimes if we're not sure if there's significant snoring or sleep disorder breathing, we can order a sleep study where it can be more formally evaluated. And we move on to the physical examination. Tonsils are right there for inspection, and we rate them usually on a 1 through 4 scale. So if we determine that the tonsils are enlarged, the question comes up, are the adenoids enlarged as well? The adenoids aren't as easily inspected. Using a special telescope in the office, we can slide through the nose if the child is older, or we could take an X-ray and determine that. So what can happen at night is a child falls asleep, and because the tonsils and perhaps the adenoids are enlarged, the tissue falls together in the midline and it obstructs. It not only leads to snoring, but sleep-disordered breathing. Your brain is always choosing breathing over sleep, and so it jostles you awake somewhat. You can't get to the deeper levels of sleep, and you pay for it the next day. We will not push you into surgery. Not everybody needs surgery. We don't want to overreact to just a few infections or minor growth of the tonsils. Sometimes watchful waiting or a course of antibiotics is really the best course, and only pressing surgery if it's something that's truly needed. When you make the decision to have a tonsillectomy and/or adenoidectomy surgery, we start the scheduling process. Our office works with you to pick a date and time that works well and at a hospital that your insurance covers. In order to have your tonsils and adenoids out, you have to be asleep. It's a general anesthesia. For children, this usually is done quite gently. They get some anesthetic, usually administered as a liquid by the anesthesiologist. Then they come into the operating room and inhale a gas through a mask, usually 8 or 10 breaths, and they're asleep. After the procedure is through, the child returns to the recovery room. Very shortly after that, they're reunited with their parents to comfort them afterwards. Very young children under the age of 3, we will watch in the hospital to be sure that there's no immediate bleeding and that they're drinking and eating well. But older children and adults go home the same day. We send them home with detailed instructions on pain control. We let children go back to school in about 1 week. We tell them not to do athletics or gym class for 2 weeks until they're fully recovered. Adults usually miss an entire 2 weeks of work. They have a longer recovery process, and so it's a little rougher trail for them. We do caution them to kind of stay near home and nearby the hospitals where we operate so that if there is any problem, we can take care of it. All of our doctors are very well versed in tonsillectomy and adenoidectomy, and we only work with excellent anesthesiologists who are compassionate in dealing with children. We have somebody that is available to answer questions or help out with problems 24/7. And I would say most parents feel quite grateful for the surgery and the improvement that their child has had. Breathing much better at night, and they seem better rested. They don't fall asleep so much when they get home from school. They seem to be able to focus better. That makes me happy.